You're at your dental visit and your dentist or your hygienist is actually explaining things to you. Some things you understand, but most you do not. Hi, Burst TV. My name is Dinene. I'm a dental hygienist, and I'm going to share with you my favorite analogies that I use on a daily basis when educating my patients. Have you been told by your hygienist or your dentist that you build up a lot of tartar or plaque? Did you know that your mouth is full of bacteria? There's good bacteria, there's bad bacteria, and those numbers actually fluctuate. And that bacteria produces a byproduct that we call plaque or dental biofilm. Now, the analogy that I use when talking about plaque or tartar is they're like splinters. So plaque is what I call a soft splinter that you can remove within a 24-hour period of time. Tartar, I explain as a pointy splinter, and tartar actually forms as quickly as 24 hours after not removing that plaque. And again, the analogy I use, it's like a splinter that needs to be removed by your dental hygienist at your recare visit. So allow him or her to actually tackle that. Tartar is also like cement that actually is attached to your tooth. So you can clean your mouth by using your Burst Sonic toothbrush. You can use some dental floss. You can use flossers. You can use proxy brushes. You can use your water flosser. You can use any type of dental aid, but you need to remove that plaque and biofilm. So let's think about this. If you get a splinter in your finger, what's going to happen? It can get tender, it could be hot, it could be painful, it could even get infected. You remove that splinter and what happens? Healing occurs. The same thing holds tried and true for our teeth and our gums. So when that plaque is left along the gum line in between our teeth, it actually causes inflammation. It's a reaction. It's the same thing, just like a splinter. And you need to remove those on a regular basis. So now we're going to dive in a little bit deeper and see what plaque can do when it's left on our enamel for extended periods of time. Like I said, it can cause inflammation along the gum line, but because plaque is very acidic, it can actually lead to what your dentist or hygienist might refer to as an incipient lesion. So what is that? It's actually the breakdown of the enamel or the outer surface of our tooth. Now, you can actually slow down the process, and in some situations, if it's early enough, you can actually reverse that process by using a fluoridated toothpaste, nanohydroxyapatite toothpaste, fluoride rinses, but it does require some cleaning with a flosser or some floss prior to using. If that plaque is allowed to sit there for extended periods of time, that incipient lesion will further break down, as we can see in this image here, and it would require a filling or restoration by your dentist. The analogy that I use for the acidity in plaque is similar to salt on our cars that result in rust. Now, I live in the Northeast, and when we get snow or ice, they treat the roads. And we know that cumulative exposure of salt and not cleaning them off our car can result in rusting of our cars. The same thing is true for our teeth. If you don't remove that plaque, the acidity will actually start to break down your enamel, resulting in those incipient lesions or full-blown cavity. Now, we know that our car isn't going to rust overnight, and we're not going to get a full-blown cavity overnight. It's the repetitive cumulative exposure to the salt or to the acidity in the plaque that gives us the end result. I hope you can relate to some of these examples that we've touched on this far, but now we're going to move in and we're going to talk about gum recession and the notching that can occur at the gum line. That notching in the dental world we call abfraction. It's a loss of tooth structure due to a number of reasons. For example, it could be from clenching or grinding, but your dentist may recommend that you put a filling in that area to actually strengthen and increase the integrity of your tooth. Because as those abfraction lesions increase and get deeper, the risk of breakage of your tooth increases substantially, as well as sensitivity. So the analogy I like to use is if you had a whole bunch of trees that you needed to cut down and you put that initial notch in there, but you left that tree and some time went by and this big windstorm comes along and comes right in, which trees are more likely to fall over? The ones with the notch. It's the same idea with our teeth. With those abfractions, your teeth withstand substantial chewing forces, and when the tooth is compromised, the risk of breakage increases. If you found this video useful, give me a thumbs up. But my dental professionals out there, I want to know some analogies that you use on a daily basis so I can incorporate that into my daily care of my patients.